All right, let's talk about something that's, well, incredibly common and affects millions of people. For decades, we've really only had one tool to fight it, and that tool is getting weaker. So today, we're going beyond antibiotics to dig into the science-backed strategies for preventing recurrent urinary tract infections.
So just how big of a deal is this? While somewhere between 50 and 60% of all women will get at least one UTI in their lifetime. It's one of the most common bacterial infections out there. And for a huge chunk of those women, about 20 to 30%, that infection is going to come right back within 6 months.
And this isn't just a personal health problem. It's a massive burden on our healthcare system. In the U.S. alone, the cost of managing UTIs is estimated to be around $2.8 billion every single year. You've got to factor in millions of doctor's visits, hundreds of thousands of hospital stays. It all adds up.
For decades, our go-to weapon has been antibiotics. But you've probably heard about the problem with that. Their widespread use has created this critical side effect, a huge spike in antimicrobial resistance. And that growing challenge is exactly why finding effective, non-antibiotic ways to prevent these infections is more urgent than ever.
So, where do we even start? Well, the very first line of defense, the one recommended by all the major clinical guidelines, begins with simple but really powerful changes to your daily habits. These are low-risk things that can have a surprisingly high impact.
You know that advice you always hear? Just drink more water. For years, that honestly felt more like folk wisdom than hard science, and this quote really highlights why. There was just no systematic scientific proof to back it up. Until now.
The evidence is now in, and it's pretty compelling. A recent meta-analysis crunched the numbers from a bunch of studies and found that simply increasing how much fluid you drink cut the rate of recurrent UTIs by nearly half. That's huge! It's an amazing testament to a really simple intervention.
But, hydration is just one piece of the puzzle. This whole suite of behavioral changes, everything from wiping technique to avoiding certain products, is strongly recommended by the major urology guidelines as the foundational first line of defense for everyone.
Okay, next up, we have to talk about the most famous and probably the most misunderstood UTI remedy out there, cranberry. The advice on this has been all over the place for decades, but today we're going to clear up the confusion by looking at what the best science actually says. And to do that, to really cut through the noise, we have to rely on the most powerful tool in evidence-based medicine, the meta-analysis. Think of it as a study of studies. By pulling together the data from lots of different trials, researchers can get a much clearer, more reliable answer than any single study could ever give us. So, why all the confusion around cranberry? Well, a huge part of it comes down to juice versus pills. See, the early studies on juice were just messy. The juice is loaded with sugar, and the placebo they used was often just other juice, so both groups were getting hydrated anyway. Plus, who wants to drink that much juice every day? Researchers realized the only way to get a clear answer was to use standardized extracts in a capsule, which gives you a consistent dose and lets you use a real inactive placebo. And the result of doing it the right way? It's crystal clear. A big meta-analysis that looked only at cranberry extract in tablets or capsules found a statistically significant 30% reduction in the risk of recurrent UTIs. The data really does speak for itself.
Okay, a 30% risk reduction is pretty significant. But here's the million-dollar question. Does this benefit apply to just anyone who takes it?
And the answer, it turns out, is a very clear no. This is not a one-size-fits-all solution. The meta-analysis showed that the benefit was specifically concentrated in people who already have a history of recurrent UTIs. It didn't really do anything for low-risk folks or for people in very high-risk situations, like patients with catheters.
But the prevention toolbox doesn't stop at lifestyle changes and cranberry. There are other powerful, scientifically backed medical options out there that offer fantastic alternatives to taking daily antibiotics.
Just take a look at these two key players. They're both recommended by major health organizations in Europe and the UK. Let's break them down one by one, because they work for very specific people and in really different ways.
First up, topical estrogen. Now this is a super targeted solution, and it's specifically for post-menopausal women. After menopause, the drop in estrogen changes the whole vaginal environment, which makes it easier for bad bacteria to take hold. Topical estrogen basically helps restore the normal acidic pH and the good protective bacteria, which makes it a much less friendly place for pathogens like E. coli.
Next is methenamine hippurate, and honestly, this one has a fascinating way of working. In acidic urine, it literally converts into formaldehyde,
which then kills bacteria right there inside the bladder. And the key finding here is huge. A major trial in 2022 found it was just as effective as a daily preventative antibiotic. That makes it an incredibly powerful alternative in our fight against resistance.
All right, so we've covered the proven strategies we have today, but science never stands still, right? Researchers are already hard at work developing the next generation of preventative tools that could completely change the game.
Two of the most exciting areas on the horizon are immunomodulation and AI. There are actually multiple UTI vaccines in development right now. The idea is to train your own immune system to recognize and fight off the specific bacteria that cause these infections. And at the same time, researchers are building AI models that can analyze health data to predict, with really high accuracy, who is most at risk for another one, which would allow for truly personalized prevention. We've covered a ton of ground here, from simply drinking more water all the way to cutting-edge AI. So what's the ultimate takeaway from all this evidence? What's the bottom line?
Think of it like this. This is your UTI prevention playbook. The foundation is for everyone. Drink more fluids and adopt those healthy habits. The next layer can be targeted supplements, like cranberry extract, but only for the right person. Then, for others, there are these powerful medical options like topical estrogen or methenamine. The most important step, though, is talking all these tools over with your doctor to build a plan that's personalized just for you.
And that really is the future, isn't it? The goal is to move beyond that one-size-fits-all antibiotic prescription to a prevention plan that's tailored to the individual. By using the right combination of tools from the toolbox, we can build a much stronger, more sustainable defense against recurrent UTIs. The question is no longer if we can move beyond antibiotics, but how quickly we can make these personalized strategies the new standard of care.
Hey everyone. Today, we're diving into something that's, well, incredibly common and just plain frustrating for so many people: urinary tract infections. We're going to look at 5 medicinal plants that have been traditionally used to help out. I mean, if you've ever dealt with a UTI, you know exactly what I'm talking about, right? That awful cycle of discomfort, the treatment, and then boom, it's back again. It can feel like a never-ending loop. And feeling stuck in that loop? So common. But here's a thought. What if the real key isn't just treating the infection when it pops up, but actually preventing it from happening in the first place? That's what we're going to explore today. Some natural approaches that might help do just that. It's a really frustrating cycle, and it hits women particularly hard. The search for relief can honestly feel endless. You go through the whole process of treating one, and you think you're in the clear, only to have another one show up. It's exhausting. So what if nature itself has some powerful tools to offer? That's where we're headed. We're about to dive into 5 medicinal plants, or herbal allies as I like to call them, that have been used for ages to help support urinary health and hopefully break that vicious cycle. All right, let's meet the team. Our 5 allies are parsley, cornsilk, horsetail, dandelion, and basil. And trust me, each one has its own special superpower. Okay, first step is one you almost definitely have in your kitchen right now: parsley. And nope, it's not just for making your plate look pretty. This stuff is a real powerhouse. So how does parsley work its magic? Well, it's got this awesome 2-pronged attack. First, it's a natural diuretic. That just means it helps you pee more, which physically flushes the bad bacteria out of your system. And second, it actually has antimicrobial properties, which can help stop a new infection from even starting. Pretty cool, right? All right, next on our list is something you probably just toss in the compost bin: corn silk. You know, those fine, silky threads on an ear of corn? Turns out they have a really long history of being used for urinary health. The real magic of corn silk is its double action. Just like parsley, it's a diuretic. But it does something else that's so important. It has this wonderful soothing effect. It actually helps relax the lining of your bladder and urinary tract, which can really help calm down that awful irritation that comes with a UTI. Okay, our third ally is a bit of a celebrity in the world of natural remedies: horsetail. And you know what? It's famous for a really good reason. It is a fantastic diuretic, which makes it great for anyone dealing with fluid retention. By making you go to the bathroom more often, it's just really effective at flushing out those pesky microorganisms that cause the infection in the first place. And a little pro tip: sometimes people pair it with ginger and chamomile for extra soothing relief. Now for our fourth ally. You might not even have to go to the store for this one. It could be growing in your lawn right now. Let's talk about the humble but totally mighty dandelion. Dandelion is another one of these amazing dual-action plants. Yep, it's a diuretic, so it helps you get rid of urine and those unwanted bacteria with it, but it also has its own antibacterial properties. That 1-2 punch makes it a really valuable tool, not just for urinary health, but for helping with fluid retention too. And last but not least, our final ally is another familiar face from the kitchen, basil. But get this, its strategy for fighting infection is totally different from the others we've talked about. Okay, so remember how the other herbs were all about flushing bacteria out? Well, basil plays a different game. It works by stopping the bacteria from growing and multiplying in the first place. It basically tells them, nope, party's over. This is all thanks to a really cool compound in basil called eugenol, which also happens to be anti-inflammatory, so it can help with the symptoms directly. Okay, so this is where it gets even more interesting. What's so fascinating is that some of these plants come with some surprising bonus health perks. It's not just about your bladder. Take corn silk, for example. Turns out it has compounds that might even have anti-aging properties. Who knew? And dandelion, it's not just for your urinary tract, it's also known as a fantastic liver protector, and it might even support your heart health. It's just a great reminder that these plants work in a really holistic way. All right, so you might be thinking, this is all great, but how do I actually use these things? Well, it's probably a lot simpler than you think. The easiest way for most of these is to make a tea. You can aim for about 3 cups a day. And for our kitchen herbs, like parsley and basil, it's even easier. Just chop them up and use them as fresh seasoning in your meals. The real secret, though, is consistency, especially if you're trying to prevent issues from coming back. Okay, before we finish up, I need to talk about what is, without a doubt, the single most important point we're going to cover today, and that is the need for caution. Listen, natural doesn't automatically mean safe for everyone. That's a huge misconception. For instance, some of these herbs are a definite no-go during pregnancy. Others can be tricky if you have issues with your blood pressure, and they can absolutely interact with other medications you might be taking. So please, here's the bottom line. This is all for your information. It is not medical advice. It is absolutely essential, I can't stress this enough, to talk to your doctor or another qualified health professional before you start any new herbal treatment. They are your real allies here, the ones who can help you use these things safely and effectively. So I'll leave you with one final thought to chew on. While all these herbal allies can be amazing for managing symptoms, maybe the real journey to wellness starts with asking, why? Why does this keep happening? What is your body trying to tell you with these signals? Digging into that question, well, that might be the most powerful step you can take.